I grew up in Windsor, Ontario. I went to high school at Vincent Massey Secondary School. I had thought that I would want to pursue a career in the sciences, maybe medicine at that time. It wasn't 100% clear. And so when I looked at my options, one of the options that I did have was doing a joint concurrent program between the University of Windsor and St. Clair College. So that's how I ended up pursuing part of my training in medical laboratory technology. So my program was a concurrent general science degree in addition to a diploma in med lab technology. So it gave me the opportunity to gain some significant practical skills that I could implement in a hospital setting. It would allow me to pursue some aspects of theoretical science training. So I think it was really simple. What drew me to health sciences was just early on, my parents got me involved in swimming lessons. And one of the things I got to do was learn life-saving skills. And I think that's what initially spurred my thought that I would like to be involved in a career that would allow me to help people, potentially in a life-saving manner. So that's what first got me thinking that I'd want to work in a hospital setting, that I'd probably want to do sciences, that I'd want to work with people. And so that's what led me down the line of looking at sciences and that background. I found St. Clair College very helpful with my studies in respect to the fact that a lot of the training that we had was both theoretical, as well as I had the opportunity then to apply it in a hands-on manner, both within the laboratory setting at the college, and then as well we had all assigned practicums, which allowed me then practice in an actual clinical setting, which I would not necessarily have been given the opportunity to do if I had just pursued a thesis or a scientific degree. Being able to see the practice of what I'd learned at St. Clair was wonderful, but it also gave me the broader exposure of now being able to interact with patients and thinking, well, maybe I want to do even more from this. And then that's what led me to decide medicine might be a good field for me to pursue. Then I had to decide where to go from there. Well, I loved going down to the ER. Like if I were to pick a very interesting part of the hospital, the ER was where I thought, geez, I want to be here if I was going to be anywhere. One of the opportunities that I had was to do family practice training and then do additional training as an emergency room physician. There's different tracks that one can pursue. I chose that because it gave me an opportunity that if I wanted to ever expand my career or change my clinical setting, then I could do that. So while I was completing my training year, I did have the opportunity to come back to the community and work on my vacations. So I did come to the Metropolitan campus here in Windsor, and I decided this was the place for me and did come back to Windsor after I completed my training, and now I've been here 9 years working in the emergency department. So my day-to-day is variable. I do shift work. Shift work works well for me because it allows me to blend my family life with my work life. So for example, last night I worked till midnight. I'm off today. I'll work tomorrow in the morning. In addition to that, I'm the medical director of the department. So I've also taken a role in education of our physician groups and our nursing groups. So I've organized the annual emergency medicine conference that's been put on. We started out with maybe a group of 10, which went to 20, which went to 40. Then I had to look at bigger rooms. Then we decided to involve other people, so the paramedics came on board. Then my husband was saying to me, well, how are we going to fit all these people, because they can't fit in our living room anymore. So that's when we decided to use the casino venues, and our most recent conference had 350 people that attended. So again, I've been very lucky also to have great friends, a very supportive family that have been, from the get-go. Early on, my parents have always encouraged me to pursue education. That was something that they wanted me to be happy in my career, but also wanted me to be successful. Well, I've been very lucky to have a very supportive family, as well as my spouse, Ramon Diab. If anything, Ramon has been my strongest support, my greatest encourager in terms of trying new things and doing new initiatives, and is very helpful to have a husband who says, you know what, you do what you need to do, we'll take care of it together. So we started out young in school together. We've both pursued equally difficult careers. We just had a baby, so she's 11 months old now, so that's a whole new challenge at this point. Her name's Vivian. Yeah, so she's 11 months old now. Just brings out a totally different part of you, but it certainly has brought out different parts of me that I wouldn't have anticipated in terms of how I interact with patients. Certainly once you've had a child, how you look at other children, how you look at other parents, I couldn't communicate that. I could sympathize with my patients, but I could never communicate that till I became a parent as well. So if I had a high school student that was considering attending St. Clair College, I would 100% encourage them to do so. I found that the teachers were wonderful. They were willing to commit the time to give you hands-on experience, to give you direct contact, answer your questions appropriately. I had the opportunity to actually do things that I would otherwise just read about in books. I could actually do it when I was at the college, and it gave me a whole different perspective in terms of how these things are applied in the real world, and it gave me a very unique perspective being able to actually learn and do it hands-on.